Good afternoon, everyone. My name is Tracy Nyer, and I'm going to be the facilitator for today's webinar. Today's webinar, Everything You Need to Know About Virginia's New COVID-19 Emergency Temporary Standards, is being delivered by Jennifer Rose. Today's webinar is one of our educational offerings of the Virginia Small Business Development Center. The Virginia SBDC is a partnership program between the U.S. Small Business Administration, George Mason University, and local host institutions throughout Virginia. With 26 locations across the Commonwealth, we provide training and technical assistance to small businesses in their local communities. Our one-on-one consulting services are available at no charge. For more information or to schedule an appointment, you can reach out to your local office. And if you aren't sure where your local office is, you can find that information on our website, virginiasbdc.org. I'd like to introduce our speaker for today's session. Jennifer Rose is the VOSH Cooperative Programs Director for the Virginia Department of Labor and Industry, and she oversees the industry's consultation and BPP divisions. Her 16 years of experience with the Department of Labor and Industry includes Senior and Lead Safety Consultant, Consultation Program Manager, and VOSH Enforcement Division Program Director. Jennifer is also an authorized OSHA outreach trainer and a certified safety professional. Before we get started today, just a couple of housekeeping items. We are recording today's presentation and we'll make that available to you through email, as well as posting it on our website, virginiasbdc.org, and we will also have the slides available. If you have any questions during the presentation, we're going to hold those questions to the end, but please just type them in the question and answer window as we are going through the presentation, and after we're finished, Jennifer will do her best to answer them. So without further ado, here's Jennifer.
Hi, thank you. Good afternoon. I'm going to pull my PowerPoint up here for you. Okay, today I'm going to be talking about the new Department of Labor and Industry Emergency Temporary Standard. And this covers infectious disease prevention, in particular the COVID-19 virus. The codification number where you can actually find it in legal code is 16 VAC 25-220. If you're interested, that's a good publication to read before you go to sleep. It is rather lengthy. Let's see, next slide. Oh, there we go. I'll put my contact information up there. It'll be, I'll put my email address again at the end of the slides, but if you have any questions about the presentation today, I will be more than happy to answer those. Okay, so why are we talking about the standard? Basically, the intent of the standard is to prevent the spread of the virus. And who this applies to is every employer that's in the jurisdiction in the state of Virginia. So basically, we're talking about manufacturing, construction industries, private industry, as well as public, state and local public governments. So starting to the text of the standard, Section 10 states that the Emergency Temporary Standard is designed to supplement and enhance the existing VOSH laws that are applicable directly to COVID-19 hazards, such as personal protective equipment, respiratory protection, sanitation, access to employee exposure and medical records, and hazard communication. Based on the exposure risk levels, the employers are separated into 4 different exposure risk level categories: very high, high, medium, and low. The Emergency Temporary Standard recognizes that various hazards or job tasks at the same place of employment can be designated in multiple categories. And we'll get into more detail about the categories as we go on. The Emergency Temporary Standard takes a layered approach to providing employee protection against COVID-19 hazards and job tasks depending on exposure risk level. There are some minimum requirements that apply to all employers, and then there are enhanced requirements that apply to those with employees in the medium, high, and very high exposure risk categories. So important dates that you want to remember is the temporary standard took effect on July 27th, and the requirements for training in the standard are in Section 80, and these will take effect on August 26th. This is a 30-day allowance period for employees to get everything in place that they need to provide the training to their employees. Requirements in Section 70 of the standard, the Infectious Disease Preparedness and Response Plan, take effect on September 25th. So this is 60 days out from the effective date of the standard. One of the special things that I will note as far as dates are concerned, there is a section, an exemption in the training section where employers do not have to train their employees on that written plan until September 25th, because obviously you can't train employees on a plan that may not have already been developed until September 25th. The standard will remain in effect for 6 months, and Section 20 of the standard provides that the emergency temporary standard will expire within 6 months of its effective date, or upon expiration of the governor's state of emergency, or when superseded by a permanent standard. And during this 6-month period that the temporary standard is in effect, the Safety and Health Codes Board is considering the adoption of a permanent standard that would replace this temporary standard. During this process, there will be a 60-day written public comment period where employers and employees from the public can write in their concerns if there are any regarding the standard. And there will also be one or more public hearings that are held once the proposed permanent standard is voted on. So what we're going to talk about now is how to protect your employees. Basically actions that you and your employees can take every day to help prevent the spread of COVID-19. Some overall ideas about protecting your employees. Obviously, social distancing. Unless you have been living under a rock the last couple of months, everyone knows that social distancing talks about leaving that 6-foot space between you and others. The standard actually refers to this as physical distancing, so you'll see those that word instead in the standard. You want to encourage employees to do self-monitoring. They should be looking for symptoms. Basically, if they're sick, they should be staying at home. Some signage is required, and the standard, which we'll talk about a little bit later, it requires that employers post signs in the workplace, reminding employees of these items here, like social distancing, washing hands, wearing face masks, things like that. PPE is an important part of the standard and protecting your employees as well. You do want to make sure that employees are using this properly and that they've been trained in how to put on, take off, clean, store, things like that with any personal protective equipment. And whatever personal protective equipment they're wearing is going to depend upon what exposure risk level your employees have, one of those four risk levels. And one thing I will point out in the standard is that personal protective equipment in the standard does not include face coverings. It defines personal protective equipment and things like N95 respirators or the surgical masks. So you want to make that distinction when you're looking at the standard. There is a distinction with face coverings not being personal protective equipment. An important element to protect your employees is make sure that they have been trained. We have a whole section in the standard that will go over on what training is required. And then you also want to look at any other workers that may be known or suspected to have COVID-19. You want to extend this beyond just your employees that are on site. You want to make sure that you take into consideration any contract workers, temporary workers, or any subcontractors that might be working on your site. So we'll get into some of the definitions in the standard. Lower risk jobs are those that do not require contact inside 6 feet with persons known to be, suspected of being, or that may be infected with COVID-19. These individuals have minimal occupational contact with other employees or the general public, or could achieve minimal occupational contact through the implementation of work practice controls. These could include engineering controls such as barriers or administrative controls such as teleworking. And this is not just the inclusion of face masks. The next category, medium risk category, these are job tasks that require more than minimal occupational contact within 6 feet of other employees or the general public. These may include, but are not limited to, employees such as waiters, grocery store workers, construction workers, hairdressers, fitness instructors, any employees in manufacturing, especially in food processing and the poultry and meat processing facilities, as well as any healthcare workers. High-risk tasks are tasks with high potential for employee exposure within 6 feet. This is exposure to known or suspected sources of COVID-19. These would include hospital workers, first responders, mortuary service workers, any dental staff. Also would include any non-medical support staff working in these hospital type environments. And the very high exposure risk level include jobs that have the high potential for employee exposure inside 6 feet to known or suspected sources of COVID-19. These individuals would include employees in the hospital or other medical realm where they are doing specific medical procedures that would generate an aerosol, things like intubation, working with postmortem with patients that have been tested positive, and certain lab procedures. We're not going to see this a lot just in the general public and those with the jurisdiction under VOSH, but it is there, and we do have employees that are exposed to those higher exposure risk levels. So how do you know what level your employees are exposed to? Several factors are involved in determining this. You want to look at the tasks that your employees are doing. Obviously, are they, what are they doing? How are they potentially going to be exposed? Do they have contact with the public? Are they standing on production lines where they're side by side with other employees? Basically, how everyday actions are putting them at risk for COVID-19. You want to look at the work environment too. Are you in an office setting or a manufacturing plant, or even if you have employees teleworking? You want to look at the presence of the virus too. Have you had any previous outbreaks at the site, or do you have a high absentee rate due to COVID symptoms? The number of employees and the size of the area need to be factored in when you determine the exposure risk level. These would be important if you have employees working in close quarters, or, like I said, working on assembly lines, things like that, where they would be limited to a small area with multiple employees. Duration and frequency of exposure, this would talk to things such as shifts, and if you have employees working shift work, and how often are they going to be exposed to the COVID-19 hazards. And the last factor that you want to look at when determining your exposure risk level is what hazards could your employees encounter. And these could include things like contaminated surfaces or airborne transmissions, anything like that. But we'll actually get into determining that exposure risk level and doing that hazard assessment in a few slides here. So I talked before about some differentiation between the 3 higher risk levels versus the lower risk levels as far as the requirements go. For employers in the very high, or medium exposure categories, there are training requirements. The employees must be trained on the hazards and characteristics of COVID-19. They need to, the training should enable each employee to recognize the hazards of the virus and also the signs and symptoms of the disease. Employees also need to be trained in the procedures that they are to follow in order to minimize those hazards. Training for these 3 categories would include requirements of the standard, characteristics and methods of the spread of the virus, what risk factors may be in play at the workplace. They also need to be aware of how the virus is transmitted, and then safe and health work practices. Obviously, these are things like social distancing, disinfecting surfaces. If you have interactions with the public, are there different non-contact methods of greeting, things like that. And training must include what personal protective equipment is required on the site. Again, things like taking an on and off and proper use. Also want to look at the limitation of the equipment that you have employees wearing. Like I said before, with the face masks, the face coverings, they aren't considered personal protective equipment, and employees need to be aware of the limitations of that a face covering does not provide as much protection as things like a surgical mask or an N95 respirator would. Other requirements include a statement about anti-discrimination. Basically, the standard requires that employers can't discriminate against employees who express concerns about their health or safety on the work site. This is not new to VOSH standards. We actually do have a whistleblower program where employees may report issues when they feel that they are being discriminated against by their employer for reporting these hazards, or if they feel that they're uncomfortable reporting hazards in the workplace to their employer. And the last requirement is an infectious disease preparedness and response plan. And we'll get into detail of what's required in this as we go along. Again, a reminder that the standard came into effect on July 27th, and there are those 30-day and 60-day requirements for the things listed here, such as the training and the written response plan. The infectious disease plan overall should include things like sick leave, telework, staggered shifts, and how you're going to inform employees of the different policies, including the Families First Coronavirus Response Act. While VOSH does not enforce this act, that is actually enforced by the Federal Department of Labor and Industry, one of the requirements is that you inform your employees of the act just so that they are aware of the allowance for paid sick leave due to COVID-19. The policy should include methods for self-reporting and monitoring of symptoms, how employees are to report positive test results, and how are you, the employer, going to notify others that may be exposed to the positive test. One thing to note when we're talking about notification of positive tests, there is a requirement in the standard that says that building or facility owners must notify all employer tenants in the building when one or more cases have been discovered on the floor and the work area where the case is located. They are not required to identify the individual. That will be kept confidential in accordance with requirements of the ADA, but they are required to inform other tenants that are in the building that and where that COVID exposure, what floor they're in, or what work area that employee was working in. And then lastly, we need to talk about return to work procedures. How are you going to get those employees back working into the workplace if they've been out after an exposure? And then we'll go into detail on all these, but this is sort of just the overall requirements of the standard. First requirement we'll talk about is the PPE hazard assessment. To the extent feasible, employers must provide face coverings to non-employees suspected to be infected with COVID-19 until they're able to leave the site. And this is in section 30 of the standard. But for a more broad range, the employers are required to assess the hazards in their workplace using a hazard assessment form, which we have provided on our webpage, and I'll give you all that as we go along. The point of the assessment is to assess the hazards in the workplace and select what sort of controls you're going to implement to protect those employees. Engineering controls, administrative controls, and then as a last resort, personal protective equipment. So there are 7 steps that employers can follow to do this personal protective equipment assessment. Step 1 is that you want to inform your affected employees of the process. Just letting the employees know, hey, this is what you're doing, this is why we're doing it. You want to discuss the reasons for doing the assessment and the procedures that you're going to go through to perform the assessment. One of the reasons that you want to include employees is because you'll be reviewing with them any job procedures, potential hazards, or any personal protective equipment that they currently use. Getting the employees involved is an important step just because they're the ones who are out on the front line being exposed to the COVID virus at their job site. Step 2 is you want to review data, any reports of work-related illnesses, near-miss events, or any safety concerns. You know, have you had, again, reports of employees being out due to sickness, or have they voiced their concerns about any of these? You want to take all that data and put that towards helping you in assessing your hazards. Step 3 is conduct a walkthrough survey, excuse me. The purpose of the survey is to identify any sources of hazards to the employees. You want to look at the layout of the workplace, where employees are located in that workplace, what are they doing, what work operations are happening, as well as any hazards that they're exposed to, or where personal protective equipment is currently being used and why. You want to use the form that we have provided, and you want to check off the types of hazards that are present within each section. Step 4 is to determine the hazard risk level. Using the definitions and the standards, you want to make sure that you select the appropriate hazard risk level. Remember, those are the very high, medium, and lower exposure risk levels. When we're talking about very high exposure risk, again, those are job tasks that are those in places of employment with high potential for employee exposure to known or suspected sources of COVID-19. The high exposure risks are jobs that have high potential for exposure within 6 feet to known or suspected sources of COVID-19. Medium exposure risks are jobs that require more than minimal occupational contact within 6 feet with other employees, persons, or the general public who may be infected with the virus, but who are not known or suspected to be infected. Some examples here would include schools, any high population density work environments, again, any food processing, manufacturing, where you have a lot of people working in a work area. Any high volume customer facing retail settings, things like grocery stores, restaurants, bars, things like that. As well as any mass gathering venues, things like sporting venues, entertainment, movie theaters. All of those will be included in the medium exposure risk level. And then lastly, the lower exposure risk level. These are jobs that do not require contact within 6 feet of persons known to be or suspected of being infected with the virus. Some examples of this, first, remote workers. Obviously, if you have those employees that are teleworking and are home during the pandemic, they're not being exposed in the workplace. Other lower exposure risk jobs would include office workers who do not have contact inside 6 feet with coworkers, customers, or the public. And any manufacturing or industrial facility workers who do not have that inside 6 feet contact with coworkers, customers, or the public. Step 5 is to determine the controls that you will implement to protect your employees against COVID-19. After you consider a plan for any engineering or administrative controls, you want to look lastly at selecting the personal protective equipment, which provides at least the minimal level of protection required for protection against those hazards. Step 6 is once you perform the assessment, which does have to be in writing, you want to make sure that the document is accessible to your employees. You need to sign and date it, whoever completed the assessment, and you can store the form either electronically or as a hard copy where employees would have access to it. And the last step after you've performed the hazard assessment is to include the need for reassessing the workplace. If there are any changes to the workplace, if all of a sudden you have employees reporting symptoms to you, or if you have new equipment or processes, you want to make sure that you reassess that workplace because the exposure levels could change, or the administrative controls that you decide to put in place. All this could change based on changing factors in the workplace. Here is a template of the COVID-19 hazard assessment that's required by the standard. This is available on our webpage for download. Basically, it takes you step by step through the things that we just talked about, where you're looking at describing the hazard, what engineering or administrative controls you're going to put in place, and what personal protective equipment you're going to put in place. And then based on that, you want to determine the exposure risk level, the very high, medium, or low. Each line of this assessment, you want to look at either job tasks, or it could be as specific as employee details or job categories. Basically, you want to look at categories of employees that may be doing the same job. You know, if you have the same retail front-end store employees, they could be all categorized under one, since they're typically exposed to the same hazards and the same controls would need to be in place. So this doesn't necessarily have to be done by employee, but you want to look at job tasks or job categories that are similar. Talk a little bit about social distancing. And again, this in the standard is referred to as physical distancing. You want to make sure that you ensure that employees observe physical distancing at all times when on the employer's property. And you could implement this by including policies and procedures that use verbal announcements, signage, or visual cues to promote that physical distancing. You want to look at decreasing your work site distancing by limiting non-employee access to the certain work areas or restricting access to only certain workplace areas to reduce the risk of exposure. You want to look at the access to common areas or break rooms. Do you need to implement things like occupancy maximums or spread chairs and tables out so that you can maintain that physical distancing in break rooms and lunch rooms? For the common areas, such as the break rooms and lunch rooms, you want to make sure that you have some sort of process in place to either have the employees clean or disinfect the immediate area after they're done, or if you have some sort of housekeeping procedure in place to make sure that those high-touch areas are being cleaned and disinfected. And then lastly, with the physical distancing requirements in the common areas, you want to make sure that you're providing either hand washing, such as a sink and running water, or make hand sanitizer available. One of the requirements in the standard for common areas is that you have to post a poster that lists 4 things. It has to include the occupancy of the space, a reminder to do physical distancing, a reminder to wash and sanitize hands, and then also a statement about cleaning and disinfecting of any shared surfaces, things like tables, chairs, vending machine buttons, anything like that that a lot of people would be touching. When we talk about cleaning, some of those high touch areas that I just mentioned, we're also looking at other areas, not just in common areas, but places like the light switches, door handles, stair railings, things like that, where you have a lot of employees or even people from the public coming in and touching those areas. The EPA has a list on their webpage of disinfectants that can successfully be used against the SARS virus. You can look on there, and they actually list product names by the manufacturer, so you can see several of those on there as well. If you're looking at having produced or buying disinfecting materials for your workplace. Another important element of the PPE requirements is the requirements for either face coverings, surgical masks, or respirators. And like I talked about before, which covering your employees will need to have is dependent on what they're exposed to. So based on that personal protective equipment assessment that you've done, that will determine what your employees will be wearing. The last requirement that I'm going to talk about today is the requirement for employees to have an infectious disease preparedness and response plan. Only employers in exposure risk levels very high and high must have a written plan. Those employees that are employers with employees in medium risk category, if they have 11 or more employees, also must have a written infectious disease preparedness and response plan. Employers have to designate a person to be responsible for implementing this plan. And we have a template plan available on our webpage, and I'll show you that link in just a little bit. So the infectious disease preparedness response plan. The plan must contain the name or the titles of the persons responsible for administering the plan. This person should be knowledgeable in infection control, how to perform a hazard assessment, and also the job tasks at your work environment. You want to make sure that the plan includes providing for employee involvement in developing and implementing the plan. Again, just like employee involvement with the hazard assessment, those employees are the ones who are doing the jobs day to day and have an intimate knowledge of what they're being exposed to in the workplace. The plan must consider and address the risk level associated with the different areas of employment, the hazards employees are exposed to, and what job tasks the employees perform at those sites. The plan must talk about where, how, and what sources of the virus the employees might be exposed to at work. This also would include members of the public, customers, or other employees that may be at your work site. Situations where employees work with more than one job task, they may encounter hazards at different exposure risk levels. So you could have an employee, when they're performing one job, be a lower exposure risk level, but when they're performing another, if they're cross-trained, they may be exposed at a medium exposure risk level. So it is possible to have employees in multiple exposure risk levels. As permitted by law, including HIPAA, employees' individual risk factors need to be talked about in the plan, as well as any engineering, administrative, work practice, or personal protective equipment that are necessary to address those risks. The plan must identify basic infection prevention measures that you will implement at your workplace. You want to promote frequent and thorough hand washing, including, again, by not only employees, but customers, visitors, and the general public that may be in your workplace. If you do not have soap and running water immediately available, then you do have to provide hand sanitizer. You want to make sure that the plan talks about how you're going to maintain regular housekeeping practices. This would include routine cleaning and disinfecting of surfaces, equipment, or other elements of the work environment where you could have more than one employee touching that surface on a daily basis. The plan should also establish policies and procedures for managing and educating visitors to the place of employment. So you may have a certain PowerPoint presentation or however the method of training your employees. You also want to make sure that you have, to some degree, some training for your visitors that come into your workplace as well. And the plan should cover how you're going to deal with that. The plan should consider contingency planning for situations that may arise as a result of outbreaks in your workplace. You may have an increased rate of employee absenteeism, or you may have to implement additional physical distancing or staggered work shifts, or even downsizing operations to control exposure to the hazards. You want to look at, can you perform the essential operations with a reduced workforce? Could you cross-train employees across different jobs? Basically, what can you do to continue operations and still deliver your essential job services? You also want to consider in your plan, or in your contingency plan, what you would do if you have interrupted supply chains or delayed deliveries. Those are all factors that would need to be included in your plan. The plan to provide for the prompt identification and isolation of known or suspected to be infected employees. These will include procedures for how employees are to report when they're exposing symptoms. Are they to report it to management, or do you have a medical person on your staff, and how are they to report those? Your plan should address infectious disease preparedness and response with outside businesses. This could also include any work that you do with subcontractors or businesses that may provide temporary employees to your work site. You want to make sure that any of those other persons that may be accessing your place of employment comply with the requirements of the standard and the requirements in your written plan. And lastly, the plan must identify any mandatory or non-mandatory recommendations that from the CDC that the employer is complying with. There is an option in the standard that if an employer is complying with CDC guidelines, they may do so in lieu of the provisions of the standard. If you choose to do that, there are requirements for the employer to be able to identify and produce what guidelines they're following, and this would have to be vetted by the Department of Labor and Industry and make sure that they are at least as effective as the requirements in the temporary standard. You also want to make sure that your plan ensures compliance with any mandatory requirements of applicable executive orders or public health orders related to the SARS virus. These would include things like right now in Virginia, we have the face covering requirements for people visiting things like restaurants. You want to make sure that your plan includes those requirements as well. So that's all that I have. It was a lot of information. We do have available to small employers in Virginia our VOSH consultation service. Basically, if you go to that webpage right there, there is a link where you can request one of our consultants to come out to your site. Right now we're doing virtual visits, but we also have the ability to provide virtual training or to look at any written programs or policies that you might have in place related to COVID or any other job site hazards. We provide those on-site reviews. This is a free service. There are no citations or penalties related to any of the things that one of our consultants might find. Basically, your only responsibility is to correct those hazards. Again, my email address on there. If you have any questions about this presentation or any of the questions that any follow-up questions that we may have not covered today. And we do have a link specifically on our webpage that is specific to the coronavirus. On there, you'll find not only the text of the standard, but also there's a link for outreach and training. And any of those documents that I referred to in the presentation today are included there. We have training PowerPoint presentations that employers can use. We have the templates for the written plan, as well as the hazard assessment, and a number of other just informational documents that are on there. We have set up a dedicated email address if you have COVID-19 questions. This is staffed by not only myself, but also our 2 enforcement directors. So we will be responding to those questions as they come in. And then lastly, if you have employees that would like to file complaints against their employers, they can do so through the standard complaint process. There's a form on the federal OSHA webpage that needs to be filled out, and those get forwarded to us, and we will contact the employer and go through our typical complaint process with that. So that's all I have. I think now we're going to take questions.
We are. Thanks, Jennifer. So let me start. We've got several of them since it was a lot of information. Am I correct in understanding that not everything applies to companies with less than 10 employees?
No. And that is for all employers in Virginia. Basically, there are very few standards that apply only to those less than 10 employees, things like record keeping, keeping OSHA 300 logs. That's pretty much the only one where you're talking about things that do not apply to employers with less than 10 employees. If the employer has 1 or more employees, they are covered under the jurisdiction of VOSH, and therefore these requirements of the emergency temporary standard apply.
Do the face masks have to be disposable?
No. And there's information about there, and we're actually putting out some frequently asked questions. One of the things that you want to look at, though, if you have employees wearing the cloth type face coverings, is how they're washing those and handling those, and following CDC guidelines where they talk about sanitizing your hands before you put it on, before you take it off, things like that.
Got a couple of questions here about risk categories. In which risk category would a medical spa providing skincare treatment, facials, and aesthetic injections become classified?
You'd want to look at, obviously, they're having interaction within 6 feet of of their clients during their procedures. You want to look at that. Basically, you're looking at the distinction between medium and high, depending on what exactly it is that their employees are doing that may be exposed to them. I guess to the extent of what that spa service is providing versus a medical service, you'd have to do that assessment to determine that. But if you've got sort of a general just providing typical spa services, those would probably be in the medium exposure risk level, but you'd have to do the assessment.
Okay. I have another one of elementary school teachers. What risk category do they fall into?
School systems are going to be in that medium risk category.
Is it possible, are we able to receive the requirements checklist? Is that on the website page that you were talking about?
Checklist for all the requirements of the standard, or because there's not really, I mean, if you look at it, there's 3 or 4 requirements. They've got the training, the hazard assessment, and the written plan. Those kind of 3 are if you had to summarize the standard, those are the 3 big items.
Okay. Where can an employer and landlords go to purchase the equipment required to meet the standards?
Not sure what they're asking about equipment here, but looking at, I guess, sanitizing and disinfecting chemicals or hand sanitizer. I mean, that's basically on the open market, I would assume, unless they're asking for any specifics about certain types of equipment.
Okay, well, if the person that typed that could follow up if they wanted to provide some additional detail. Who's responsible for the training, employer or OSHA rep? Is there an online webinar for training or a test that we must take for compliance?
The requirement does fall on the employer. Currently, we're not offering any webinars on that. However, we do have a PowerPoint presentation that's available for the public to use on our webpage. It is very thorough. It's over 100-some pages long. You're not required to use that PowerPoint presentation, but if you do, that one's guaranteed to meet all the requirements of the standard. But you can develop your own as long as it does meet all of the requirements, all of those training requirements, all the elements that are must be included per the standard.
So we have a question about, is there a summary? Is there a one-pager on dates, definitions, standards that people could post somewhere? I think this is coming from the SBDC for their clients to get out to businesses.
Basically everything's on that web page. It's very clearly written out. Hazard assessment, the dates, everything like that is on there. There are also a couple of other documents, things like an infograph. There is a section for lower risk training. That's a good overview of the requirements of the standard. That is a brief overview. And there's also an overview PowerPoint, which kind of highlights the things that we talked about today. That PowerPoint is available on the webpage as well.
Okay. Do even low exposure risk employers need to complete the PPE assessment?
Yes.
How do I categorize my employees? Is it relative by industry? Example, we're a healthcare facility. Are we all high risk due to our industry, or do we categorize relative to job descriptions in the office?
Job tasks.
Are the reporting requirements of positive cases to VOSH?
Yes, if you have 3 or more cases, positive cases, there are requirements to inform VOSH, just as you would if you had any other hospitalization, things like that. There are requirements to inform others. If you have an employee that was tested positive within 24 hours, you do have to inform the employees that may have been exposed in that same work area, or any contractors, or anyone that may have been exposed to that employee. And within 2 weeks, the employer has to report, or the employee, has to report to the employees, to the employer within that 2 weeks of finding out that they were tested positive.
We provide support to the federal government, and an employee working on site has stated they're following the lead of the customer and have been told they do not need to wear a mask even though it's less than 6 foot distance. What are our requirements as the employer for the employee that are working on customer site?
Employers are responsible for their employees, whether they're working in their work facility or at another facility.
What if an employer has a majority of employees, maybe all but one, that are low risk hazard positions, job tasks, but has one employee that may encounter medium risk hazards? Does the employer have to provide all employees COVID-19 training within 30 days in this situation?
The 30-day requirement, the lower risk employees would just need to be provided with that informational sheet that's online, and that medium exposure employee would need that training within those 30 days. The only requirement that wouldn't be included, because they have less than 11 employees, they are not required to have a written plan if just one employee falls into that medium category.
And can you also elaborate on the difference between medium risk workplace versus a workplace that may have some but not all medium risk job tasks, and how these differences may affect an employer's ability to prepare for the training and plan deadlines?
Not sure what they're asking there. Could you read it again? Let me see if I can.
Sure, can you also elaborate on the difference between a medium risk workplace versus a workplace that may have some but not all medium risk job tasks, and how these differences may affect an employer's ability to prepare for the training and plan deadlines?
Okay, so you could have an employer site that everyone is doing tasks that are within that medium exposure risk level. But like I said, you could have employees that fall at the same site but fall under the different categories. The requirements are just the same as I said before. Like if you have medium exposure risk employee levels, they do have to be provided that training and then the written plan, but only if you have 11 or more employees.
Are we required to report COVID positive test results for employees that are teleworking and not at an exposure to others?
No, because then it's presumed that they haven't been exposed in the workplace if they haven't been in the workplace. So that would not be covered.
Okay. I assume that nonprofits would need to comply with these rules just like any small business. Is that true?
Correct.
Okay. Childcare centers that are following licensing guidelines per CDC need to have their plans approved? ?
There's no approval process from VOSH to approve written plans. When you're talking about employers or industries following other guidance documents, there is something in the standard about like public school systems, public and private education, where if they are in compliance with the Department of Education requirements and certifications, then they would be considered following our standard, the emergency temporary standard. There's not one in particular to childcare because that is a different agency that would be enforcing those requirements. So that employer would be required to follow the emergency temporary standard. Like I said, there was that exception where if an employer can show that by following those CDC guidelines, they are at least as effective as the requirements of the temporary standard, they can do that. But they're just going to need to provide information to VOSH of what those guidelines that they're using if asked.
Okay. Is there signage that the state will send out to business, or do you provide a template for that?
A template should go out probably by the end of the week or next week. A signage for those common areas. That's the only thing that we have provided. Any other additional signage that employees want to put up can be produced by them. I will tell you that the CDC has a good web page where they have all the printable documents that have everything from how to wash your hands to how to wear a face covering, things like that. So that is a good resource.
Okay. Can we ask a customer to leave our small retail business low risk if they're not wearing a mask, regardless of if it's for a medical reason?
When you get into things like medical reasons, for employees, they do have to have that waiver. We don't really get into how how the waivers, or even if the waivers are required for those public employees, but because employees are coming into your site, you can require them to comply with any written plans, procedures that you have in place.
What if you provide a face mask to an employee, but they reject to use it?
You have the option of, looking at having them in other areas. There are other control measures other than face coverings. Can you put them in a work area where they're not exposed to other coworkers, or can you have them telework? So there's other ways around just not wearing the personal protective equipment. But you can, ask them to do it, and they can be asked to leave your site if they're not going to follow your plans, but you obviously need to look at that also non-discrimination plans, because you can't discriminate employers that have reasons such as medical or religious reasons why they can't wear those masks.
These guidelines apply to employer-employees. Do they also apply to landlord-tenant relationships?
Yes, the landlord-tenant relationship, like I said, falls into that notification requirement that the tenant is required to inform their building owner if they have a positive case. And then likewise, the building owner is required to inform any tenants, any other tenants that that there has been a positive case in their building.
If you were informed of a positive COVID staff at your place of business, you must inform all other staff, but should you also inform guests that have visited your business?
Only if it's known exposure to that that particular employee. Obviously, if you have the general public coming in, you're not going to be able to track down everybody that was there that day. However, you would be able to know what contractors might have been on the site or subcontractors, but you are required to inform those other employers. Yes.
Did I hear you say that if you have less than 11 employees, you do not need to have a written plan? If so, for all risk categories?
Correct. I'm sorry, no, that's for the medium. Very high and high are required regardless of the size. If you are medium risk exposure level, that's 11 employee requirement. If you have 11 or more, then you do have to have the plan, and less, you do not have to have the plan.
Okay. With the reporting requirements of positive cases, 3 or more, when does this reset? Example, if there are 3 within a week, does the reporting requirement reset?
Every time after you have more than 3, I guess that's what they're trying to ask. This would just be, it's similar to our regular injury or illness reporting requirements. If you have 2 injuries, one happens one day and then one happens the next day, that is 2 reporting. You have to report that twice to us. So it'd be the same with the COVID-19 positive cases. If you have 3, you need to report that. And again, if the next day you have another 3, then that would need to be reported as well.
Okay. Is there a sample of a return to work policy on the website?
There is not. Basically, the template and the plan, the plan is really bare bones plan where we're just stating, okay, you need to have the requirements. This is what you need to include: a return to work policy, a reporting process. That would be up to the employer to determine. There may be some guidance on the CDC webpage. Department of Health may have some, but we are not specifically putting out those individual policies because it does vary largely on what the employer wants to do.
Okay. What is the definition of good faith in terms of requirements like the requirement for sneeze guards to go all the way to the ceiling?
Good faith will be a factor if we're looking at any potential for violations of the standard. It is a new standard. It's all a learning process, not only for the employer but for us as well. But good faith would go into it if you're looking at potentially not being exposed to hazards or just not completely following the standard. We do have an enforcement option to, if they were to cite it, they could cite it as a de minimis violation, which basically carries no penalties with it. It's basically just our acknowledgement that says you are not specifically following this particular standard, but you've done what you need to do to protect employees.
Okay. Wow, there's still a lot of questions. What are the requirements if an employee has a known exposure to someone that's COVID positive, but they're not sure if they're positive?
We don't get into that detail. That would be something that the employee would need to talk with a medical professional about.
Okay. Who is responsible for the development of safety standards if you work in a remote office? The remote office is a rented location, not a home office. Should the remote office manager handle developing those standards?
If you have employees working in an alternate site, they are, it would be the employer's responsibility to look at, making sure that work environment is is as safe as if they were working in the the main office.
Okay. Are inspectors coming out to check all completed plans after September?
No. Basically, our inspection process for this standard is the same as it would be for any other standard. Obviously, we have a lot of inspections that are generated because of complaints. For the most part, that's what we've seen so far. Is that if an inspection is conducted, it has been the result of a complaint coming in.
Okay. What are the penalties for not conforming to the standards?
Penalties for any violations of this standard are just like penalties for any other standard. There is a range of costs. It is really a case-by-case basis. I can't give even an estimated number because there are so many factors that go into it. There are different penalty amounts if the hazard would be classified as an other than serious hazard or a serious hazard. We also look at different factors such as the size of the employer, any good faith efforts that they've made, or if they have any history with VOSH. All of those factors go into the penalties.
Okay. If you have an employer that has a majority of employees, maybe, nope, I got that one already, sorry. Can you explain what the guidelines are for quarantine for employees that have traveled for leisure or business out of state?
That would be a question for the Department of Health.
Okay. If there is anyone in need, oh, never mind, sorry. What are the requirements for faith-based organizations?
Just if they were to follow under the jurisdiction of VOSH, if they have employees, they are required to follow the regulations.
Are face masks also required when a face shield is used?
Face shields can be used as a substitute for those face coverings. CDC has put out a lot of guidance about that and comparing the two, but that would be sufficient because it does cover the face or the mouth and nose as well as the eyes.
If an employee has been exposed to COVID and goes on a 14-day isolation, does the employer have to pay the employee while they're on isolation?
That would be a question for the Federal Department of Labor and Industry because that falls under that Families First Act.
I've got some other questions about risk. So what risk would a small construction company be where there are only 3 employees that are all family?
It really just depends upon what they're doing.
A daycare center?
Same thing.
So I think that if you have specific questions about what the industry, it's really depending on what they're doing. So I'm gonna skip over those. Where in the standards can I find the face covering requirements?
It's under the general requirements as well as each of the individual exposure risk levels where it talks about either respirators or surgical masks or face coverings. So it's kind of spread throughout.
Okay. Does the training have to be based on the employer's plan?
That is a requirement of the training. The training must include what the employer has implemented for the plan.
How do the guidelines apply to events, conventions, large gatherings?
You have to look at the way that state OSHA applies or has jurisdiction over that. We look at obviously the employer or the company that is putting on the event or the convention because they if they have any employees. Basically with VOSH standards, it is all about the employee relationship. So we'd have to be able to show that there is some sort of employer knowing about and having to protect those employees in that employer-employee relationship.
Okay. If an employer conforms to all these guidelines and an employee still becomes ill, is the employer liable?
That's a legal question.
For high-risk companies, will the state of Virginia require the employees to use the phone app COVID-wise?
That's not something that we administer, so it's not in the requirements of the standard, no.
Okay. Do volunteer agencies such as fire departments, rescue squads fall under these standards?
No, and volunteers are not covered by any of the VOSH standards unless there's some sort of paid relationship where they're getting some benefit from the employer.
All right, well, we have hit 4 o'clock and I want to be respectful of everyone's time. So Jennifer, thank you so much for presenting this today, and hopefully Jennifer, she's given us some great information and she's made everyone a little bit more comfortable with how to implement these new standards. And after, we will be sending out the PowerPoint as well as making the recording of the webinar available to everyone. We have additional upcoming webinars and training sessions throughout the state that can be found on our website, virginiasbdc.org. We also, on our website, we have created the business recovery webpage, which we've developed to help businesses continue to navigate this dynamic environment created as a result of COVID-19. And these guidelines cover a broad range of critical considerations, and while you can use them by themselves, they were designed to be used in collaboration with a business consultant at your local SBDC center. So please reach out to your center if you have more questions, and Jennifer made her information available if you had more questions on these new standards. And thank you everyone for participating today.
Thank you.